Rhizotomy is where you do a needle electrocautery of the pain nerve for certain parts of the spine, what we call the lumbar facet joints. So that's why proper evaluation and diagnosis is so important when assessing somebody for a rhizotomy. There are multiple structures. When somebody comes in with back pain, there are multiple structures in the back that can cause pain, whether it's a disc, a muscle, ligament, or the joint, or a nerve. And so when you assess the patient, when you do their diagnostic workup, which may include x-rays, MRI studies, or even certain spinal injections, and that's where the rhizotomy comes in, is before you can do a rhizotomy, you have to do what we call a lumbar facet block or a medial branch nerve block, which is the nerve that gives pain sensation to these facet joints. If the patient receives excellent short-term results from these type of spinal injections, we can proceed with the rhizotomy, which is still an outpatient procedure for the patients themselves. It doesn't take any longer than a regular injection, and they go home the same day. And their post-rhizotomy feeling of recovery, if you will, is not that much longer than just a standard injection. They may have some more soreness because you're going in there and cauterizing those pain nerves, but after that, it could be anywhere from 70% to hopefully 100% relief of their pain. That can last anywhere from 6 months to 2 or 3 years. I've had patients sitting in my clinic 3 years later saying, hey, it recently started coming back a few months ago. The reason it can come back is because those nerves do regenerate back into the joint and could potentially create pain all over again in that same area. If it does come back, it can always be repeated if they do have extensive relief from it.